Tony Fabrizio, who's the president's pollster, has called the senior voting group, the deciders for their ability to move an election when they get rallied up behind an issue. They are feeling this in their pocketbooks.
Welcome to the Real Clear Pennsylvania podcast. I'm your host, Charles McElwee, and I'm joined today by Darren Grubb, spokesperson for Medicare Advantage Majority. Darren, thanks so much for being here.
Charles, great to be with you. Thank you for having me.
So, perhaps one of those overlooked issues, but why don't we begin with the program itself? Many of our viewers on the younger side may not know its importance twofold as policy, but also as a force in electoral politics. Can you break it down for us?
Yeah, so when a senior turns 65, he or she, they have the choice between traditional Medicare, traditional fee-for-service Medicare, which is exactly what it sounds like. Every time you need a service, you pay a fee through supplemental coverage, or Medicare Advantage, which is a public-private partnership between the federal government and private providers, which creates competition, keeps costs low. The appeal of Medicare Advantage is that, unlike traditional Medicare, Medicare Advantage offers high-quality, affordable, comprehensive care that goes beyond traditional Medicare. And so Medicare Advantage programs often include hearing coverage, dental coverage, vision coverage, in-home care, prescription drug coverage, Medicare Part D supplement that we talk so much about. And importantly, Charles, Medicare Advantage includes a cap on out-of-pocket costs, which is important because should a unexpected medical event come up, seniors know what their absolute maximum out-of-pocket spend will be to take care of their healthcare needs. And so that gives seniors financial peace of mind, especially during these high inflationary, high cost times that we're still in. And I will tell you that Medicare Advantage is the preferred choice for more than 35 million seniors around the country. That's well over half of the eligible population. And in Pennsylvania alone, 1.6 million of your seniors have chosen the Medicare Advantage program. That's 54% of your eligible Medicare population. And so it's a very popular program, strong satisfaction rates every year, high enrollment rates every year. We think it's the better choice.
When did this program begin? When was its inception? And has it garnered bipartisan support, or would you associate this more as a Republican supported program?
Yeah, that's a great question. It's been around for 25 years or so. Public-private partnership between the federal government and providers. So it's Republican in nature in terms of very free enterprise, free market economics at play to create competition, to keep costs low for beneficiaries. And it's been a good program. It's been a great program for taxpayers because it encourages seniors to stay active in their healthcare journey, meaning stay proactive about taking care of themselves, about preventative care, wellness programs, things like that to keep them out of the hospital, hopefully in the long run. And so over the long term, that's helped keep costs down for the program.
So, with the inflationary reality in which we live, Medicare Advantage itself, have rates gone up? Are they at risk of going up? What's going on?
Yeah, I'll give you a quick bullet on that. So every year, CMS, the Center for Medicare and Medicaid Services, comes out with an advanced rate notice, which is the proposed percentage increase of what the federal government will invest in the program for the following year. This year, CMS came out with a very flat proposed increase of 0.09%. And meanwhile, healthcare costs are rising on the order of 7% year over year. They're up 7.2% in 2024 and 7.1% in 2025. And so that's a big delta between those two. And so our coalition got very active. We reached out to members of Congress, to the White House, to CMS, and made sure that seniors' voices were heard, that is going to create some financial challenges in their lives. They landed on a final rate notice of closer to 2.5%. Step in the right direction. Certainly not keeping up with the rising healthcare costs, but better than where they started. The reality is that as seniors consider their plans for the coming year in 2027, open enrollment starts in a couple of months right before the election. They're going to be paying attention to what the variable and the change in their healthcare cost may be, and so they're paying attention to this both as a day-to-day reality issue, but also as a political issue and a policy issue.
So it's a policy issue back in the 22 cycle, back when Dr. Mehmet Oz was running for U.S. Senate in Pennsylvania,
Yeah.
and he was a big proponent of this program. So is it a surprise? Like what? has he explicitly stated his position on the rate increases, or where is he on the subject?
As you mentioned, it has broad bipartisan support. There have been efforts to cut this program. This is a program that was cut in previous administrations, and so our coalition is really focused on making sure that seniors are educated and empowered to make sure their voices are heard with their lawmakers. Seniors, unlike younger workers, they don't have adjustments to their income based on inflation year over year. Most seniors on the Medicare Advantage program have incomes of $25,000 a year or less, and so any cuts to this program, passes cost directly onto seniors, and it's something they have to shoulder and burden. And this is a program that seniors have paid into their entire lives, entire careers. They expect it to be there when they retire. They want to age gracefully and independently and on their own terms. And so any cuts to this program, result in higher out-of-pocket costs, higher deductibles, higher premiums, less access to the doctors and the services that they need. And so it has real impact on their daily lives, and that's not good for seniors who as a community and a country we're supposed to take care of.
So when you look at the electoral map this cycle across the country, Pennsylvania is ever more important when you consider the redistricting fights, and really we have a sense of the partisan composition of other states. But in Pennsylvania, we have four swing congressional districts. Democrats could grab four, Republicans could keep all four, and that's a
Yeah.
stance. There are four incumbent Republican members of Congress in the first, seventh, eighth, and 10th congressional districts in the eastern half of Pennsylvania. Are you monitoring how this issue is playing out in those districts?
We are in Pennsylvania, but around the country. We are a nationwide coalition of hundreds of thousands of advocates, nationwide, who are part of our coalition of caregivers and beneficiaries and healthcare leaders and community leaders. So this is something that we're focused on, especially through the lens of the upcoming election. In 2024, more than 40 million seniors turned out to vote. In that election, that was the highest turnout of any voting group, any demographic. Seniors are motivated, they pay attention, they're well educated on the issues, they have the ability to move an election if they rally behind an issue. And as we know, affordability is going to be on the ballot this year. We did a survey earlier this year of Medicare Advantage seniors, and we found that 91% view this program not only as a healthcare issue critical to their healthcare, but also the cost of living, because it's such a huge part of their annual spend. And so, yeah, with affordability on the ballot, we want to make sure that members of Congress, candidates understand how important this is to seniors. And yes, we do expect this to be a part of the conversation as we're talking about affordability and across our daily lives.
I mean, the daily debate is what will be the top concern this midterm, right? Foreign policy, the Iran war,
Yeah,
inflation, cost of living, affordability. Is this a sleeper issue that in an off-year election, in midterms, I mean,
yeah.
for example, I believe it was in 24 that the average age of a voter was 52 years old. Voters trend older in off-year elections. So in your sense, how big will this Medicare Advantage issue be for seniors when they go to the polls? Will that be top of mind when they monitor where members of Congress or their opponents stand on this issue?
Our research says that is certainly going to be an issue that they are paying attention to. Again, as you talk about affordability, you talk about if you think about what seniors spend their money on, their income goes, a large share is allocated toward healthcare and making sure that they are well and can enjoy their retirement and their golden years. And so, they are feeling this in their pocketbooks. You have been in politics a long time. I've been around it for a long time. We know that pocketbook issues often win the day in big elections, and you're feeling the impacts of inflation and the high cost environment that we're in at the gas pump, the grocery store. Seniors are feeling it in those areas as well as their health care. And so, this is something we imagine that will be top of mind as they go to the polls. We know that the president is aware of this. His team is aware of this. I know the president's in Pennsylvania today, talking about the economy and the cost of living. And so I would hope this issue would come up because it's something that he campaigned on, strengthening and protecting the Medicare program for seniors. And many members of Congress who ran in 2024 campaigned on this as well. And so, we expect them. Our role as an organization is to make sure that we hold them to account and make sure that they know that their constituents are paying attention to this. Tony Fabrizio, who's the president's pollster, has called the senior voting group, the deciders. for their ability to move an election, again, when they get rallied up behind an issue. And so we do believe this is going to be top of mind. We believe that seniors are going to support members of Congress and candidates who are strong on this issue and who will stand up for them.
Well, this is doubtless an older state, and those voters are motivated to go to the polls really every year. So certainly we'll be monitoring this on our end. Darren, thank you so much for joining the program.
Great to be with you. Thanks for having me.
This has been the Real Clear Pennsylvania podcast. I'm Charles McElwee. Join us daily on our website, realclearpennsylvania.com, and stay tuned for our future episodes. Follow us on Twitter at RealClearPennsylvania. Take care.